Welcome to our attendees who have joined us today and to those joining us via the recording to the North Simcoe Muskoka Specialized Geriatric Services practice short for March 2022. My name is Alison Jayawira and I'm one of the Psychogeriatric Resource Consultants with the NSMSGS. We will start with a land acknowledgement. We are gathering on the traditional lands sacred to many Indigenous nations. I'd like to acknowledge the traditional territory of the Anishinaabe, which includes the Odawa, Ojibwe, and Potawatomi nations, collectively known as the Three Fires Confederacy, the Haudenosaunee and Wendat nations, and the presence of other First Nations, Métis, and Inuit residing in the Simcoe Muskoka territory. Most of us have come here as settlers, immigrants, or newcomers in this generation or generations past. We are all treaty people. As such, we commit to collaborating based on the foundational assumption that Indigenous peoples have the power, strength, and competency to develop culturally specific strategies for strength for their communities. We are dedicated to honoring Indigenous self-determination, history, and culture, and are committed to moving forward in the spirit of reconciliation and respect for all First Nations, Métis, and Inuit people. We are pleased to provide our practice short 2022 Looking Forward through Zoom webinar. All participants are muted and your videos are off. Please note that there's a chat box at the bottom of your screen for you to share with other participants, as well as a Q&A tab where we ask that you write questions for today's presenter. Today's session is being recorded and will be accessible on the Specialized Geriatric Services website under the Education tab, under Monthly Education. For those of you who've missed previous practice shorts, you will find their recordings in this location. If you're watching this watching the recording, welcome. And a reminder, if you want to join us live, practice short sessions are offered the second Friday of the month at 8:30 in the morning. With the start of a new year, we wanted to select a theme for our practice shorts that would help us set the stage for 2022. The theme this quarter is Looking Forward. While we're still in a pandemic, we remain committed to supporting older adults with complex needs. It's fair to say that we've all had some COVID fatigue and burnout, but we are hopeful and want to focus on how best to support our clients. This practice short series will continue to build on previous themes, and we hope to bring you timely, relevant, and practical information for your respective practices. Last month, we focused on using the PIECES framework to support the best possible care. This month, we will be focusing on navigating this pandemic through the consideration of both and thinking. I'm pleased to introduce today's speaker, Jackie Saule. Jackie is the Psychogeriatric Resource Consultant supporting Couchiching and Muskoka. She is a registered nurse with experience in public health, addictions and mental health counseling, and long-term care. Jackie is passionate about lifelong learning and the provision of person-centered care throughout the healthcare spectrum. Welcome, Jackie.
Thank you, Alison. I'm honored to be speaking today, and thank you for everyone for joining us. As the PRCs were planning this session, we were mindful of the declaration or the anniversary of the declaration of the pandemic 2 years ago. Just a second here. So we were mindful of the anniversary of the declaration of the pandemic 2 years ago. We wanted to create an opportunity for reflection as well as information sharing today. Throughout this session, I invite you, whether you're watching live or viewing the recording, to reflect on your journey personally, professionally, societally, through this extraordinary time. To begin the session, I want to share a brief story with you about an interaction I had with my spouse this past Christmas. The news of Omicron and increasing cases was on my mind as we planned to have a normal Christmas. I felt sad, scared, anxious, and disappointed, yet my spouse couldn't understand why. He was excited and optimistic, as is his character, and looking forward to connecting with those that we love most. He explained that he felt relieved that we could rapid test before our visits, that those eligible were all vaccinated, and that we had all been mindful of our exposures leading up to the holidays. And he was right. We had so many more resources in our COVID toolbox to decrease risk this Christmas as opposed to Christmas 2020. And I was right in my feelings of sadness, anxiety, and fear. That day, ahead of celebrating the holidays, I needed Luke's dose of hope and to honor my feelings. Both experiences were and are valid. My hope for the session today, in addition to reflection and information sharing, is that I can help you feel a sense of hope too. We're living through a really challenging time, and we have come a long way. Today, we're going to explore the journey of the past 2 years and look forward while considering both and thinking. To begin, I want to start by taking a moment to reflect on March 11th, 2020, when the World Health Organization made the assessment that COVID-19 would be characterized as pandemic. I'm going to invite you to reflect on where you were that day. What were you thinking? What were you feeling? If you're live and feel comfortable, I invite you to share in the chat box. If you're watching the recording, I invite you to write your reflection down. Personally, I was co-facilitating a session in person with my colleagues, Kim and Allison. We were all hyper aware that day to expect a phone call or email with important updates. We were worried of the potential risk of being out in a group of people. I remember us half joking that the hand sanitizers we brought would go missing before the laptops, given the circumstances. Later, in the grocery store, I remember long lines, empty shelves, and the eerie silence of the store, despite the busyness in there. The nervous energy was palpable. Maybe you had a similar experience. This visual is a representation of our collective COVID journey these past 2 years. Here I've taken the Ontario's epidemiological curve from the Government of Canada, and I've inserted a few significant events through the pandemic. This is not a comprehensive timeline at all. There's so much has happened. This is just a sampling. The COVID curve represents case surges and declines, while also illustrating the ups and downs that we faced personally, professionally, systemically, and societally. There have been bumps, big hills, peaks, and valleys, times when we've been really challenged, and times we might have been able to catch our breath, even just a little. I'll start on the left side of the graph, and we'll work our way to the right. So on January 25th, 2020, Canada reported its first case of COVID-19. On February 9th, 2020, the global death toll from COVID-19 had already surpassed the death toll of the SARS epidemic of 2002-2003. On March 11th, 2020, the World Health Organization characterized the coronavirus outbreak as pandemic for the first time. By the end of March 2020, 1/3 of the world was living under COVID restrictions. Towards the middle of the page, we see when vaccines began to be authorized for use in Canada on December 9th, 2020. Not even 1 year since Canada reported its first case. And on December 22nd, the Simcoe Muskoka District Health Unit began vaccinating people in our community who were most at risk of severe infection, hospitalization, and death. By March 2021, multiple vaccines had been developed and approved for use globally. Between March and November 2021, there was another wave, another variant or more of concern, more pivoting, more adapting, more challenges. On November 26, 2021, Omicron was named a variant of concern, and Canada had reported its first confirmed Omicron case. That's where we see the steep surge of cases associated with that most recent wave. January 2022, antiviral medications were authorized for use in Canada. So people who tested positive for COVID can now be prescribed treatment at home to prevent severe disease, hospitalization, and death. In just 2 years, this is how far we've come. We're at the star over here on the right side of the graph. We're descending the Omicron wave, but ultimately we might all be in different places in terms of our risk tolerance, our readiness to return to normal, adjusting to the easing public health protections, our mental health, our personal lives, our work. Where we are today might mean something different to each of us, despite us having lived collectively through this roller coaster of events. I'm just taking a peek at the chat box. Thank you for sharing your experiences of that early pandemic. Yeah, I see. Oh my goodness, there was deaths, there was new babies. Thank you for sharing. Very different experiences for sure. We have come a long way. Those early days were so frightening. Okay, so we're going to think about where we are today, and I really appreciate you sharing those experiences from early on. Here we are today, March 11th, 2022. We've experienced a lot of loss these past 2 years. Some of the loss is concrete, like the tremendous amount of death, while some of the loss is ambiguous, which means it's unclear, it's less concrete, and it lacks a resolution. For example, ambiguous loss encompasses missed milestones, birthdays, births, funerals, graduations, retirements, weddings, lost time with our loved ones, lost or changed relationships, disrupted routines. Life as we knew it is not the same. There has been lots and lots of loss. And there have been some silver linings, some of which may not have been possible without the immense pressure imposed upon us by the pandemic. We have vaccines. Global resources, human and monetary, were thrown into research and development as a response to COVID-19. Currently, Public Health Ontario and Simcoe Muskoka District Health Unit report that 85% of Ontarians and 77% of residents in Simcoe Muskoka have completed their primary series of vaccinations against COVID-19. We have antivirals that can be prescribed and taken at home. We have treatment pathways that allow for more effective treatment of COVID-19 than in March 2020. We know how, and we have the resources to mitigate risk in person. We know how to protect one another. We have leaned into using technology to connect us. We know how important connection is. Initially, the term social distancing was used to describe staying 6 feet apart from one another. That language eventually changed to physical distancing to reflect the significance of maintaining our social connections. We know how negatively residents in long-term care and retirement homes were impacted as a result of isolation. Care partners witnessed the struggles of those who were home with limited supports from the outside world. Care adapted to include porch visits, virtual visits, and increase access to virtual appointments and resources. This morning, for example, we have about 60 people on the call from across North Simcoe Muskoka and maybe even beyond. I'm not sure if a 30-minute monthly meeting like this would be possible for us in person. Just this week, the CBC announced an article about how surgeons from Quebec have created and delivered training virtually to medical professionals supporting people in the Ukraine who are requiring emergency procedures. How incredible is it that technology can be used to help people across the world in these dire circumstances? No, connecting on Zoom is not the same as meeting in person, and yet it has connected us. Virtual funeral services, baby showers, weddings allow for people across the world to participate in these events that they may not have been able to participate in before. We have experienced a lot of loss and gain. We're going to talk a little bit about resilience here. The American Psychological Association defines resilience as the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress, such as family and relationship problems, serious health problems, workplace and financial stressors, or a pandemic. As much as resilience involves bouncing back from those difficult experiences, it can also involve profound personal growth. While these stressful, challenging, or adverse events can be painful and difficult, they don't have to determine our outcomes. There are many aspects of our lives we can control, we can modify, and we can grow with. That's the role of resilience. Becoming more resilient not only helps us get through difficult circumstances, it also empowers us to grow and improve our lives along the way. Based on the experiences I've had working with the teams on this call, I would argue that you've each exemplified resilience in your practice throughout this journey. You've showed up for your clients and colleagues, you've adapted to the changes implemented, you've tried new ways of doing things, you've advocated for those in your care, you've been present for those who need you. You've attended sessions like these to better yourself and better your practice. We have come a long way as a result of resilience, and we might be getting tired of being so resilient. We're going to talk a little bit about surge capacity now. So in April 2020, in light of the newly declared pandemic and global response, Francois Mathieu of Tend Academy, an organization that provides education and resources for healthcare professionals, published a number of self-care strategies entitled the resource, "This is a Marathon, Not a Sprint." As we adapted to meeting and supporting teams virtually, this concept of a marathon was really helpful to conceptualize that this pandemic, this disruption of normal, would be a long haul. I'm not sure any of us really expected the marathon to be quite this long, and I'm tired. I don't know, maybe you are too, which brings me to the concept of surge capacity. So the PRC group has discussed this concept before, but if you're not familiar with it, Hale, in her 2021 article, "Your Surge Capacity is Depleted, It's Why You Feel So Awful," describes surge capacity as a collection of adaptive systems, mental and physical, that humans draw on for short-term survival in acutely stressful situations, such as natural disasters. Hale goes on to describe that natural disasters occur over a short period of time, even if the recovery from the event is longer term. But pandemics are different. The disaster itself stretches out indefinitely. Hale also notes that the destruction resulting from the pandemic is, for most people, invisible and ongoing. Think ambiguous loss here. We also need to consider the impact not seeing one another in person might have on how we perceive the experiences of those around us. We may not know the losses others are experiencing because there's less opportunity for water cooler chat, overhearing part of a conversation that provides some insight into the life or the goings on of your colleague, or bumping into someone you haven't seen in a while and having that chance to catch up. Pre-2020, we may have had more capacity to reach out to one another or support someone better if there was a loss. The pandemic is happening to everybody. We are all depleted. So our responses or lack of response may reflect that. Despite us being 2 years into this, we're still beginners, and that's okay to feel tired, and it's okay to give ourselves some grace in how we're coping with it all. One of the strategies Hale described for coping and building our resilience through ambiguous loss is to start experimenting with both and thinking. Is both and thinking a familiar term to anyone here? I invite you to add yes or no to the chat box. All right, let's see here. No, okay. All right, no, not a typo. So I'll start by sharing a little bit here too. This is a picture of my daughter, Lydia. She was born in June 2020. Pandemic life is all she knows, which is evident by her love of masking herself and her dolls. In fact, I think mask was one of maybe her first words. For me, both and thinking means the following. Grieving the maternity leave I thought I'd have, attending moms and tots, visiting with and getting help from family members, meeting mom friends, and feeling grateful to be safe at home together, bonding, feeling scared about the world around me, and being so preoccupied by this new little person in my life that I couldn't focus so much on that worry. Hale describes feeling trapped in a home that felt like a prison and a haven, which I think is very relatable. Professionally, both and thinking means feeling Zoom fatigue, and having the increased capacity to connect with people across the sector on a regular basis, like at our monthly retirement home or adult day program education sessions. Missing in-person education and benefiting from virtually connecting with colleagues across the province and nationally. As I've mentioned, we've been working with teams throughout the system, and perhaps both and thinking in your practice could mean feeling disappointed that you can't do things in the way you used to, and still making a difference in the lives of those that you're supporting. In the pandemic, we saw a restriction to visiting in congregate settings and the recognition of just how important essential care partners are as part of our teams. We worked with reduced resources and continue to make huge impacts on the lives of those that we were helping. I'll explain both and thinking in a little more detail here. Essentially, both and thinking is an alternative to binary thinking. We're programmed to think in binary terms, either or, yes, no, win, lose, right, wrong, for, against. Both and thinking requires really retraining ourselves to acknowledge that two things can be true and valid at the same time. Both and does not diminish or negate a feeling or experience. It is about truly accepting both and creating that space for both. I was disappointed that Omicron was surging at Christmas and grateful to have tools to visit loved ones in a safe way. We have been through a lot in the past 2 years, and we have adapted. We have adapted, and it has been really hard. We have seen and experienced significant loss, and we have made incredible gains. Scientific achievements, new life, new coping skills. Maybe somebody has taken on a new hobby, new access to things. Working in healthcare is challenging and it's rewarding. Things have changed, and maybe it's an opportunity. In 2021, Harris and Donner published this article, What If? Reimagining Structural Change for the Nursing Workforce of the Future. In the article, the authors discuss what it means to build and sustain healthcare of the future, and it's quite a powerful article. They describe the past 2 years have demonstrated that we are not in a new normal, but in something new altogether. In the context of this, they're suggesting that instead of referring to where we are as the new normal, we've entered into something new entirely, a time in our lives, a time in healthcare that is completely new to all of us. This term new altogether seems especially fitting when in the context of the past 2 years, by coming all together collectively, as we have throughout the pandemic, found new ways to foster connection with one another, our clients, residents, patients, we can create something new entirely. Our being all together is what gives us strength. It renews us. It creates opportunity. So here we are. We're descending the Omicron wave. We've come a long way since March 2020. Hopefully we are on the last stretch of this marathon, getting close to the end. I'd like to share this quote from the Harris and Donner article because it really resonated with me. We must think and plan for the future while the present is powerfully demanding us to act now. I invite you to reflect on your role, the services you provide, the people you help to support, and the system as a whole. Do we want to return to what was, or do we want to create something new altogether? What is the system going to look like as we rebuild and we recover from this virus? What would you like the system to look like? Consider what worked before and what is working now. It's been a long haul, and we keep moving forward while learning to live with this. My challenge to you is to practice both and thinking, and it will take some practice. You can consider both and thinking in your life, personally, professionally, in response to the system, and how you envision the new altogether that we have this opportunity to create. I hope this session has provided a chance for reflection and acknowledgement of your personal resilience, the resilience of your team, clients, system, society, and perhaps I have offered a glimmer of hope as we continue to navigate this new altogether. Thank you so much.
Thank you, Jackie. I wonder if any of the attendees have any questions, if you want to put them into the chat, the Q&A tab. I've been keeping an eye on the chat box as well. Jackie, thank you so much. Today is very much so a poignant day in history. And you've allowed us time to both reflect over the past 2 years and to look forward to maybe a new altogether. And there, it's evident from the chat box that you've given us space to reflect. It hasn't always been easy for folks, and lots of accolades in the chat box too, that it has resonated. So thank you very much. And thank you very much to all the attendees for your participation. It's been, today is a day. So take a moment today, please, everyone. I'll get you to move to the next slide. So again, moving forward, please look to our website in the coming weeks for the registration link for our new practice short series, Spring 2022. The next practice short will occur on April 8th at 8:30 in the morning. So look to that in the next couple of weeks. And I just want to also mention that we have some spring education sessions coming up, both virtually and in person, which is something we have not been able to do for the last 2 years. So very, very excited about this. As a quick reminder, there is a PISA session starting March 28th, 2-day session for regulated healthcare folks. Registration is closing on Monday for that, and it's being supported. So it is well worth your time to get into that. Also, I'm really looking forward to April 6th. We're offering a positive approach to care in person in Barrie. And April 20th and 21st, a seniors mental health program in Couchiching. So please look to that. And again, everyone, have a wonderful day. Thank you for coming.